All right, hello, welcome. And today, let us continue our discussion with neuroanatomy. Okay, my name is Hua, and I will be the teacher accompanying you with this lesson. And so, we will go into lesson 3 today. And lesson 3 is all about the meninges and the vasculature of the CNS. Hopefully, this will be a short and sweet lecture where I will tell you about the membranes that surrounds the brain and the spinal cord, as well as a very special fluid called the cerebrospinal fluid that runs within the subarachnoid space within these three membranes. And then after that, I will tell you a little bit about the arteries and the veins of the brain and the spinal cord. So let us begin. Okay, so our contents today are going to be meninges. Number one, meninges are the membranes that surrounds the brain and spinal cord for protection as well as other purposes. Okay, and then we will go into a special type of fluid that runs in within the subarachnoid space that is present in between these meninges. That is called cerebrospinal fluid, or CSF for short. And then after that, we'll go into the vasculature of the spinal cord, and then finally the vasculature of the brain to round us off today. Now, let's go to meninges. Okay, so what are meninges? So meninges are going to be these special membranes, okay, that are going to separate the bones, okay, of the skull as well as the vertebral canal, right? These membranes are going to separate those things with the surface of the brain and the spinal cord. Okay, so you can imagine this. You have the bone that is on the outside, right? Like, for example, this is the bone of the brain. Then this one right there, that is the parenchyma of the brain, right? This is brain matter. You have, like, the gray matter over here, and you have the white matter over here. Okay, so in between these two structures, there's a space. And in that space, we will have three membranes. Okay, the number one membrane is called the dura mater. The dura mater is a very hard and tough membrane that's on the outside. Then in the middle, we'll have another membrane, this membrane right here, that forms extensions, okay, to the third membrane. That membrane right there, that with these extensions there, is called the arachnoid mater. And then finally, we will have this membrane here that goes very closely onto the surface of the brain, and we call it the pia mater. Okay, so there are three membranes that is going to be from outside to inside. Okay, from the bone all the way to the brain matter or the spinal cord matter, we'll have dura mater, arachnoid mater, and pia mater. Okay, so if every single where, okay, in the nervous system, the central nervous system, these three membranes are the same, then we'll not have a lot to say about them. Okay, they are just three membranes. But there are some differences in between the meninges of the brain and the meninges of the spinal cord. And we will get through that in this lecture today as well. Okay, so the meninges also support, nourish, and protect the brain and the spinal cord. And of course, it will consist of the dura mater, the arachnoid mater, and the pia mater, like we have said before. Okay, so the pia mater is the innermost membrane, and it contains microvasculature, like the capillary networks or something like that, in order for the nutrient and the oxygen, as well as other exchanges, okay, that occurs in between the blood and the brain matter. Okay, so yes, so let's talk about the outermost membrane, the dura mater. The reason why it's called the dura mater, because it's hard. Dura is hard. Like, for example, let's just say durable. Okay, durable is a term that's mean basically very not easy to wear down. Okay, very hard, not easy to wear down. So with that in mind, you can say that the dura mater is the hardest and toughest membrane that's going to be surrounding the outermost, okay, outermost section of the meninges. This is the outermost membrane of the meninges. Okay, so the dura mater will be a little bit different, okay, in the brain than the spinal cord. How different? Let me tell you. Okay, like, for example, we have the brain right here. This is the brain. Okay, this is the brain right there. There we go. This is the brain right there. Okay, and then you have that area there. Very nice. Okay, let's just move it to the middle there. And then after that, we'll have from outside, there will be bones. Okay, let's just say the bones is this. This is the inner surface of a bone. Okay, this is the outer surface of a bone. Okay, so we have the inner table here, the outer table here, and in between there's a whole bunch of spaces. Okay, that is basically the orientation of a typical bone of this of the cranial cavity. Okay, and so the first membrane that surrounds that surround the brain and the spinal cord, but especially in this example, the brain is going to be called the dura mater. And the dura mater, in the brain, there will be a very, very special arrangement for the dura mater. At the brain, the dura mater will have two layers. Okay, there will be two layers. One layer is here. Okay, one layer is here. It's going to go and it's going to be very, very tightly associated, okay, with the cranial bones. Okay, and we call that layer the cranial layer or the periosteal layer. Periosteal layer of the dura mater. Okay, the periosteal layer of the dura mater. Then you have another layer of dura mater on the sides of the brain. There is not very separate with the periosteal layer. But then when you get to certain specific areas, like right here, you can see that there is a very, very big space right here, right? This layer, the second layer of the dura here, is going to go very deeply inside here and then go back up again. Okay, and it's going to go back and adhere to the periosteal layer of the dura mater once again. Okay, that second layer over here, right, is going to call the meningeal layer. Meningeal layer of the dura mater. Okay, meningeal layer of the dura mater. So there are two layers. Number one, the periosteal layer is outside and the meningeal layer is going to be inside. Now, in between them, especially right here, you can see there's a space. And in that space there, you will have a very big area of venous blood, okay, that runs within this area. Okay, and those area of venous blood that runs in between the two layers of the dura mater, we will call them the dural venous sinus. Okay, the dural venous sinus, actually sinuses, because we have more than one of these dural venous sinuses. Okay, but this sinus here, that is right here, okay, going in a little bit into the longitudinal layer of the cerebrum, okay, that sinus right there has a special name. You call it the superior sagittal sinus. Superior sagittal sinus. Okay, superior sagittal sinus. So yes, so you have dural venous sinuses. In this example, we have the superior sagittal sinus right there, which contain venous blood. Okay, and after that, what do we have? We will have the arachnoid matter over here. The arachnoid matter is going to be adhering very tightly, okay, to the meningeal layer of the dura mater. Okay, right there. And then adhering very tightly to the surface of the brain is the third layer, the pia mater. The pia mater is the only layer right there that you can see that is going to cover the surface of the cerebrum or the brain there perfectly. It goes into each and every single gyri and sulci. Okay, it's going to go into the surface. It's going to basically goes very deep into the grooves. Okay, into the grooves, the sulci right there, and go out again. Okay, and that one would be the pia mater right there. You see that? And there will be extensions. Okay, there will be extensions right here. These fibers that are going to extend from the arachnoid matter to the pia mater. Okay, so you call that the arachnoid extensions. Okay, these are just simply collagen and collagenous, the collagenous fibers as well as the elastic fibers that are going to be running from outside from the outer arachnoid matter to the inner pia mater. Okay, now as you can see, there is a space, right? Even though, like, there are a lot of fibers in here, there is a space in between the arachnoid and the pia mater. And in that space, we have another type of fluid that is running within that space. Like, for example, this type of fluid right there, that is running within that space right there. Right? So the space, okay, the space itself is called the subarachnoid space. Subarachnoid space. Okay, and the fluid that runs within it is called cerebral spinal fluid. Okay, and at the middle of this lesson, we will learn how cerebral spinal fluid are formed and how it is going to be running within the ventricles of the brain, and then how it gets into the subarachnoid space, and then how it will be drained later on. Okay, so now just imagine. Just remember that, like, we have subarachnoid space and cerebral spinal fluid within that space. Okay. Now, notice something. From the subarachnoid space right here, there will be structures. These structures right here, right? this structure right here is going to run from the subarachnoid space into the durovenous sinuses, and it's going to have these villi extensions over here. Okay, those structures. And that structures right there, right? These two structures that I have drawn over here for you, those are called the arachnoid granulations. And as you can see, these arachnoid granulations are going to connect these two areas, the subarachnoid space here and the durovenous sinuses, especially the superior sagittal sinus up here. Okay? And these are going to be very important later on. So pay attention to that. Okay? Arachnoid granulations, very important later on. Okay, so just as a recap, the dura mater of the brain, there will be one outer layer, which is called a periosteal layer, that is going to be very, very close to the surface of the inner table, okay, of the skull. Okay, and then there's another layer, and that other layer is going to be separated at special areas. Okay, and that's going to be the meningeal layer. Okay, and that meningeal layer, oh, I forgot to draw out one more thing. And that meningeal layer, guys, okay, is going to extend deeply. Like, for example, remember, we have this the meningeal layer here, right? It's going to extend a little bit more deeply into the fissure. Okay, it's going to extend very deeply into this fissure right here in between the two cerebral hemispheres. Okay, and so it will form the structures. This structure right there is called false cerebri. Okay, false cerebri. Okay, this is one of the structures that is formed by the meningeal layer, okay, of the dura mater, as it extends deeply into the various sulci of the cerebrum and in between the cerebrum and cerebellum. Okay, we will form false cerebri, and then we will also form tentorium cerebelli as well as diaphragma celli. We will talk about those structures later on. Okay, so yes, so remember, we'll have two layers of the dura mater, and they are going to be separated right here. And that space of separation becomes a sinus, a durovenous sinus, in this case, the superior sagittal sinus. Then you will also have the false cerebri, which is basically two layers of the meningeal dura mater going as one and goes very deeply with it into the longitudinal fissure that is separating the two cerebral hemispheres. Okay, very important. Yes, and then as you can see, the structures of the two layers of the meningeal layer of the dura mater, they are going to come together to make some structures. This one here, this entire structure right here is basically a separation, a dural separation in between the two cerebral hemispheres. We call that the false cerebri. And then we will also have two layers of dura that is going to separate. Up here is the cerebrum and down here is the cerebellum. So you will have tentorium cerebelli. So these two structures here. Okay, in order to see where exactly they are, let's just draw again the surface of the brain here. Okay, so imagine this is the cerebrum, right? These two are two cerebral hemispheres, right? Okay, and then you have midbrain, pons, medulla, spinal cord. Here you have the cerebellum up down here, right? And in the cerebellum, within the cerebellum, right? And inferior to the cerebellum, okay? And superior to the cerebellum and inferior to the temporal lobe, there is a fissure right here. You see that? Now, when you have the dura mater, you have the outside of the dura mater, which is the periosteal layer, is going to be covering the outside here because it's going to be very close to the bone. But then you're also going to have the two meningeal layer that is going to be here. And at this location, the meningeal layer is going to make these two extensions that goes in within the groove in between the temporal lobe and the cerebellum. And up here, it's going to do that again, except in this case, it's going to go in between the two cerebral hemispheres like that. So that structure right there, you will call it the false cerebri. The false cerebri. Okay? And that structure right there, you will call that the tentorium cerebelli. Okay? So we have false cerebri in between the two cerebral hemispheres and tentorium cerebelli in between the cerebrum up top and the cerebellum below. Okay, so yes, those are the two structures, and this is how you will see these two structures right there. Okay, and then another image so that you can see where the false cerebri is and where the tentorium cerebelli are. Okay, and now finally, at the level of the pituitary, you will have also two layers of the dura mater. Okay, the meningeal layer of the two dura mater. They will form another structure here. And that structure is called the diaphragma celli. And the diaphragma celli basically is going to be separating the hypothalamus above and the pituitary gland below. Okay, so you can see diaphragma celli like that. They will separate the hypothalamus above and the pituitary below. That's diaphragma celli. Okay? Okay. Now let's talk a little bit about the spinal dura mater. The spinal dura mater is a little bit different than the dura mater of the brain. Okay, let's draw out the spinal cord here to find out. Okay, so outside the spinal cord, what do we have? We will have the bone, right? Transverse process. Okay, this is the pedicles. This is the body. Okay, this is the typical vertebra. And then within the vertebra, there is a canal or a foramen. Okay, you call that the vertebral foramen, right? This foramen right here. And within that foramen, you have the spinal cord. This is a spinal cord, right? And this is the orientation of a typical segment of the spinal cord. Gray matter and white matter surrounding it. Okay. So now, adhering to the bone. Okay, adhering to the bone of the spinal canal. Okay, but not entirely taking up all the space is the dura mater. As you can see here, there is no separation between the periosteal layer of dura mater as well as the meningeal layer of dura mater here. They're just one layer. So it is simply just one layer of dura mater here. Okay, because the two layers have already pretty much like fused together. Okay, so you don't have a separation in between the two layers of dura mater here. Okay, but what you do have a separation of is that outside of the dura mater is a space. Okay, that space does not exist in the brain. Okay, like you can see here, that space does not exist in the brain. Okay, not under normal conditions, but they only exist. Okay, only exist at the spinal cord normally, and that space right there is called the epidural space. Okay, the epidural space. Okay, and the epidural space usually is going to be filled with fat. So you have the epidural space here that is filled with fat. Okay, and this epidural space that is filled with fat here is not present in the brain, but it's only present within the spinal cord. Okay, within the spinal cord right there, epidural space. And if you were to insert a needle into the epidural space, especially at the lower vertebral levels, okay, you can paralyze the nerve roots within the epidural space, and that is a procedure that is known as epidural anesthesia. Okay, that is very, very commonly used within OBGYN procedures. Okay, but essentially what you do in that situation is that you insert a needle into this epidural space right there, and you get the anesthetic in there. Okay, so that it will spread out and it will paralyze. Okay, it will paralyze the nerve roots that is around that area. Okay, epidural anesthesia. Okay, so now you have the the spinal dura mater will not adhere to the vertebral canal very tightly. They will be separated by the epidural space that contains the fat and the veins. The basivertebral veins are going to be there as well. As here, you can see that this is the epidural space right there. You see that? Okay, and now the dura mater in the spinal cord is also going to form a dural sac that extends to S2, and it will surround the filum terminale. Okay, the filum terminale, remember, is the pia extension of pia mater from the conus medullaris all the way down. Okay, all the way down to the coccyx. Okay, now from S2, that filum terminale is also going to be joined by a dural sac. Okay, that surrounds the filum terminale and escorted all the way to the coccyx. Okay, yes. Okay, and now let's talk about the arachnoid matter. Okay, the arachnoid matter is the middle membrane. The middle membrane will have a lot of extensions going down onto the pia mater, and in between the arachnoid space, okay, in between the arachnoid space and the pia mater, there will be these fluid. Okay, this fluid is going to be in between the arachnoid and the pia mater, and that fluid is also called the cerebrospinal fluid. Okay, so where is the cerebrospinal fluid? Where is the cerebrospinal fluid contained? It's going to be contained within the subarachnoid space. Okay, subarachnoid space. Okay, so subarachnoid space is going to contain CSF. Very good. Okay, and now remember, in the brain, okay, in the brain, the arachnoid matter will form these structures right there. And those structures are going to go from the subarachnoid space all the way into the dural venous sinuses. Okay, to what? To what end? So that it can basically drain cerebrospinal fluid from here all the way into these veins. Okay, why? We will talk about it later. Okay, we will talk about it later. Yes. Okay, so also in the brain, as you can see, the subarachnoid space of the brain, right? This one here, this space right there, that is brown within this image, is the subarachnoid space of the brain. And as you can see, the subarachnoid space of the brain, there are places, okay, there are places where it isn't very much like, tightly adhered to the surface of the brain. Like these are very tightly adhered to the surface of the brain, right? Right? But there are places like this place, or this place, or this place, or this place, where the subarachnoid space opens up. Okay, subarachnoid space kind of opens up, and more cerebrospinal fluid can be found within those spaces. And those spaces are what is known as cisterns, or subarachnoid cisterns. Okay, subarachnoid cisterns. And in this picture, there are 4 cisterns that I want you to know. Number 1, you have the interpeduncular cistern. The interpeduncular cistern is basically in between the 2 cerebral peduncles of the midbrain. Okay, we have the interpeduncular cistern. Then we have the prepontine cistern that is in anterior to the pons. Okay, and then we'll have at the back here, we'll have the posterior cerebellomedullary cistern. Okay, where you have the junction in between the medulla and the cerebellum. Okay, there will be a cistern in between that. That will be the posterior cerebellomedullary cistern. And finally, over here, you have a cistern at the level of the quadrigeminal plate, the superior and inferior colliculi of the midbrain. You will call that the quadrigeminal cistern. Okay, so there are 4 cisterns I want you to know. Number 1, the interpeduncular cistern here. Then you have the prepontine cistern here. Then you'll have the posterior cerebellomedullary cistern here. And finally, the quadrigeminal cistern right there. Okay, very good. And so there is a clinical correlation regarding with the interpeduncular cistern. Is that you have the vessels, okay, the vessels related to the circle of Willis that feeds the brain, that opens into these cisterns right there from both sides. Okay, and so when there is a berry aneurysm of those vessels, like for example, when the vessels bulge out like this, okay, it can burst. And when it can burst, it can release the blood into these cisterns. And you can see that on a CT scan. Okay, and so because of that, you have to know where these cisterns are, especially on a CT or MRI, because you are going to have to use it again when a patient has a subarachnoid hemorrhage. Okay, a patient comes to you with a headache described as the most painful headache he or she had ever had. Okay, and you have a CT scan, okay, of the brain done, and you see that in the CT scan there is basically opacity or whiteness within the interpeduncular cistern and the ambient cistern surrounding this. Okay, this is the ambient cistern. Then you immediately know, okay, so this is a subarachnoid hemorrhage. Okay, yes, very good. Okay, so the spinal arachnoid matter will adhere to the inner surface of the dural sac very, very tightly, and there is no subarachnoid, there is no arachnoid granulations in the spinal arachnoid matter. Okay, and there is another cistern that is called the lumbar cistern that contains the cauda equina, and this is the site for lumbar puncture. Okay, and it is usually at the level of the lower lumbar spinal cord. Okay, yes, lower lumbar vertebral column. I'm so sorry, lower lumbar vertebral column, around like the level of from L2 to around L5. Okay, that's where the lumbar cistern is located. Very good. Okay, now the pia mater. The pia mater is pretty much like the same, with some differences in between the brain and the spinal cord. The pia mater is the innermost layer that has micro vessels that help nourish the outer layer of the spinal cord and the brain. Okay, and for the pia mater of brain, it's going to cover the entire cerebral cortex. It's going to go very deeply into the sulci. Okay, very deeply into the sulci, and this is the only meninges that does this. Okay, now for the spinal pia mater, the spinal pia mater will have these extensions out, and these extensions, as you can see right here and right here, is going to go laterally and anchor the spinal cord laterally to the bones. Okay, and you will say that these are going to be denticulate ligaments. Okay, and those denticulate ligaments are going to be like throughout the spinal cord, and it's going to connect the spinal cord with the surrounding bone. Okay, so yes, as you can see here, this is one denticulate ligament. Okay, and another one down here, and you will have another one down here and down there, and so on and so forth. Okay, denticulate ligaments. Yes, and then let's talk about cerebrospinal fluid. Cerebrospinal fluid are going to be a very special type of fluid that is present within two places. Number one, the subarachnoid space, like we have said before, subarachnoid space. And then number two, the ventricles of the brain. Okay, as we have already seen when we talk about the structures within the brain, right? There are some structures within the brain. There are cavities that are called ventricles, and in those ventricles, there are cerebrospinal fluid. Okay, so now these cerebrospinal fluid are going to be secreted by one unknown as the choroid plexuses in the ventricles, and they are very, very clear fluid and low in protein, very similar to glomerular filtrate. It is going to be secreted from 80 to 200 milliliter, and it's going to be renewed 4 to 5 times a day. Okay, and how does it renew? Because the cerebrospinal fluid never stays still. It will travel from the brain, inside of the brain at the ventricles. It will travel throughout the ventricles. Then it is going to go out into the subarachnoid space. Then it will go back, okay, to the superior sagittal sinus and go back to the blood. Okay, how? We will talk about that later. Okay, another thing that you need to understand is that these choroid plexuses are going to form the cerebrospinal fluid. But how does it form cerebrospinal fluid? Cerebrospinal fluid is essentially a very special modification of plasma, which means the choroid plexus are going to be structures that contains blood vessels. And in those blood vessels, it will take the plasma of those blood vessels to make the CSF. Okay, and so after that, the CSF, when it has already circulated around the brain and the spinal cord within the subarachnoid space, what will it need to do? It will need to return to the blood, right? From the blood it came, so now it will need to return to the blood, right? And where would it return to the blood? At the arachnoid granulations. Remember these structures? Remember these structures? This one and this one? This is how the CSF is going to be made back into venous blood and go into the superior sagittal sinus. Okay, so now what does that look like? Okay, what does that look like? Okay, we will say in the next slide. But before that, let's go on to the functions of the cerebrospinal fluid. What is the function of cerebrospinal fluid? First off, cerebrospinal fluid surrounds the brain and spinal cord. Okay, and it makes the brain and spinal cord very buoyant. Okay, like for example, you can think of the brain and spinal cord as floating. They are floating within the bones that contains them, the brain case as well as the vertebral column. Why is that important? Simply because of the fact that, for example, if you hit your head here, okay, if you hit your head here, and your brain does not have a fluid cushion in between the bone and the occipital lobe, what will happen? Occipital lobe will slam into the occipital bone. Brain is very, very mushy, guys. Brain is very mushy. And so when it slams into the occipital lobe like this, it gets damaged and you can't see. Why? Because your optic radiations from the optic nerve will project onto your occipital lobe. And so if you do that, then you can't see. You're blind, right? You're blind. Okay? And so a person without cerebrospinal fluid does not have anything that cushions their brain, okay, from basically colliding with the skull all the time, okay, and they will not live long like that, okay. So cerebrospinal fluid is going to protect the brain and spinal cord by reducing the damage caused by collisions. Okay, and also it will nourish the cerebral cortex, and it also generate a potential that facilitate the nerve impulse conduction. So all of that can be done using the cerebrospinal fluid. Okay, very good. Yes. Next up, where is the cerebrospinal fluid contained? First off, within the two cerebral hemispheres. There are going to be two of these ventricles. These are called lateral ventricles. There are two of them, one on each of the cerebral hemisphere. Okay, so now the lateral ventricle will have choroid plexus within it, and the choroid plexus will secrete out the cerebral spinal fluid. After it has gotten the plasma from the blood and modified that plasma a little bit, they're going to give that cerebral spinal fluid into the lateral ventricle. Okay, from the lateral ventricle, the cerebrospinal fluid is going to go through a hole. Okay, the hole right here. Okay, let me just do this here. This is a lateral ventricle, right? And cerebrospinal fluid is going to produce, and then it's going to go through a hole right here. Okay, as you can see, this is the hole right here. That hole right there, you call it the interventricular foramina of Monro. Okay, interventricular foramina of Monro. So cerebrospinal fluid is going to flow from the lateral ventricle through the interventricular foramina of Monro all the way into this space here. That space right there is in between the thalami as well as in between the two hypothalami. Okay, and that space right there is the third ventricle. Okay, the third ventricle. So in the third ventricle, there's also choroid plexus that it will produce more cerebrospinal fluid. And that cerebrospinal fluid will join the cerebrospinal fluid that goes through the interventricular foramen of Monro, and it will flow to the next location. Okay, and where it flows here, it will pass through, okay, a special canal, okay, within the midbrain, and that canal is going to be called the cerebral aqueduct. Okay, and cerebrospinal fluid is going to flow from the third ventricle through the cerebral aqueduct, and also finally arriving here at this space right there, which is the fourth ventricle. Okay, so let's review that for a little bit. Cerebrospinal fluid is going to be secreted by the choroid plexus of the lateral ventricle, goes through the interventricular foramina Monro to the third ventricle. There will be choroid plexus in the third ventricle that produce even more cerebrospinal fluid, and those cerebrospinal fluid is going to go through the cerebral aqueduct here all the way to the fourth ventricle. Okay, makes sense so far? Okay, and so next stop, in the fourth ventricle, you will also have choroid plexus. And that choroid plexus will secrete even more cerebrospinal fluid inside here. And finally, from the fourth ventricle, the cerebrospinal fluid is going to get into the subarachnoid space, which is this space here. How? Let me tell you. Okay, let me tell you. Here, in between the fourth ventricle and the subarachnoid space, okay, the fourth ventricle is here. The subarachnoid space is here. Okay, there are three holes. One hole is here. The other hole is on the opposite side, which we don't see right now. Okay, another hole is in the middle right here. So you have these two holes here on the sides, one on the left and one on the right, and another hole here. Okay, and another hole here in the middle. Okay, and so you will have these two holes that are on, that are on the two sides. You will call them the lateral apertures of Luschka. Okay, the lateral apertures of Luschka. While the hole in the middle, you'll call it the median aperture of Magendie. Okay, of Magendie. Okay, some people call it Magendie, but I'm just going to call it Magendie. Okay, so you have two lateral apertures of Luschka and one median aperture of Magendie. And cerebrospinal fluid will run from these three apertures from the fourth ventricle going into the subarachnoid space. And in the subarachnoid space, cerebrospinal fluid is going to circulate all around the spinal cord, okay, and all around the brain, like that, okay. In the subarachnoid space, it will go all around the spinal cord and all around the brain, keeping those two structures floating within the subarachnoid space, right? And then after that, what happens? After it has run for a while in the subarachnoid space, the cerebrospinal fluid will need to be reabsorbed back to where? From blood it came. Now to blood it will return. Okay? And so because of that, cerebrospinal fluid is going to go up here, and then up here, what do you see? There are arachnoid granulations. And those arachnoid granulations is going to take that cerebrospinal fluid, convert it back to like, you know, convert it back to venous blood, and then dump it over into the venous blood of the superior sagittal sinus up here, so that it can go back through the sinuses, back to the internal jugular vein, all the way down into the right atrium, so that the cycle of blood can go back again. Okay, and so that is basically the movement of cerebrospinal fluid. So now let us go through that one more time before we're done with cerebrospinal fluid here. First off, where will we begin? First off, lateral ventricle here. The choroid plexus of the lateral ventricle will produce cerebrospinal fluid. Then that cerebrospinal fluid will go through this one, interventricular foramen of Monro, to go to the third ventricle. And the third ventricle, more choroid plexus, is going to give even more cerebrospinal fluid, which will go through the cerebral aqueduct over to the fourth ventricle here. From the fourth ventricle, you have two lateral apertures of Luschka and one median aperture of Magendie that will get the cerebrospinal fluid to go into the subarachnoid space. Then, in the subarachnoid space, cerebrospinal fluid is going to circulate. And then after it circulates, it will go back up here to the arachnoid granulations, convert it back to venous blood, and get into the superior sagittal sinus, so that it can go back to the right atrium, and the whole process begins again. Okay, and that is the circulation of cerebrospinal fluid. Very, very important topic. You need to understand and retrace the steps of this topic. Okay, very, very important. Okay, finally, let's talk about the vasculature of the spinal cord and the brain. Let's talk about the vasculature of the spinal cord first. Now, for the vasculature of the spinal cord, let's just think about it like this. Okay, the spinal cord looks like this. Posterior sulcus, then you have the posterior funiculus, lateral funiculus, anterior funiculus, and then you have the anterior fissure, right? This is the central canal, right? And then you have gray matter, and then surrounding the gray matter will be the white matter. Okay, so imagine this. Okay, you have one fissure at the anterior surface of the spinal cord here, right? So running within that fissure at the anterior there is an artery that runs throughout, okay, the spinal cord, throughout the length of the spinal cord. Okay, there's only one single solitary artery that does this. You call it the anterior spinal artery. So how many anterior spinal artery do we have? One. That is the correct answer. So there is only one anterior spinal artery, and it runs anteriorly, okay, within the anterior longitudinal fissure all the way down the spinal cord. Okay, and now look, there are two posterior fissures here, posterolateral fissures here, right? And at the level of the posterolateral fissures on both sides there are going to be two arteries. And those two arteries are also going to go down the back side, the posterior side of the spinal cord as well. And so those two are going to be called posterior spinal arteries. Okay, how many posterior spinal arteries do we have? 2. Exactly, that is the correct answer. Okay, and so it will run these 3 arteries, the 2 posterior spinal arteries and the 1 anterior spinal arteries are going to run throughout the spinal cord from up to down. Okay, and so look, when you have a very long artery, like these 3 arteries are very long arteries because it has to go throughout the spinal cord, then you will have to have branches going to the arteries at different levels from a different artery. Okay, what does that mean? Let me tell you. Here, look. From the anterior surface, this is the anterior surface. You have 1 anterior spinal artery that goes down, right? At each level, there will be branches from multiple arteries that contributes to this anterior spinal artery, right? There can be branches from where? There can be branches from the vertebral arteries. Okay, the vertebral arteries will give these branches into the anterior spinal artery. And then you have the posterior intercostal artery will give branches to go in there, as well as this lumbar artery that goes and give branches to go in there and supply the anterior spinal artery. And then you have lateral sacral artery also gives their branches to go and supply the anterior spinal artery. Okay, and you will also have the vertebral arteries, the posterior intercostal arteries, the lumbar arteries, and the lateral sacral arteries, again giving branches to the posterior, to the 2 posterior spinal arteries that runs down. Okay, so the key here is to recognize that when you have a long artery from up to down, you will need to have the branches that goes to them from multiple levels, from multiple arteries. If not, then you cannot have one artery that goes up and down like that and give the same amount of blood to every segment of the spinal cord like that. Okay, so that is the important thing about spinal vasculature. So now how about the vasculature of the brain? The vasculature of the brain, guys, if you can still remember, is this thing. What is that thing? Circle Willis. Very good. Now, we have already a separate video on drawing the circle Willis, so I will not talk about it in a lot of details, but I will talk about some of the major branches that is going to become very, very important later on. Okay, so now, the first thing that you need to know, the circle Willis are going to contain first the 2 ICAs, internal carotid arteries, then the 2 vertebral arteries, going up and fusing into the basilar artery up here. Okay, so now the 2 internal carotid arteries are also called the anterior circulation of the brain, while the 2 vertebral artery as well as the basilar artery is going to be the posterior circulation of the brain. Okay, so anterior circulation, ICAs, posterior circulation, vertebrals and basilar arteries. Okay, so now what are the branches from the ICAs? Number 1, you have anterior cerebral branches. Okay, and anterior cerebral branches are going to be connected on the anterior side by the anterior communicating artery, ACOMs. Okay, and then after that, you will have the posterior communicating artery that goes down and connects with the posterior circulation. And finally, you have a very important branch, okay, from the internal carotid artery. And that branch right there, you can see it is the biggest, as well as some people consider it as a continuation of the internal carotid artery. That is going to go outside there and going on to both sides, okay? And those arteries are going to be called the MCAs, okay? Middle cerebral arteries. So the ICAs are going to have 3 branches that are of significant importance for the brain circulation. Number 1, it will have the ACAs, anterior cerebral arteries. Then it will have the MCAs, middle cerebral arteries, and then it will have PCOMs, posterior communicating arteries. Okay, and connecting with the posterior communicating arteries are these 2 branches here, the posterior cerebral arteries. But the posterior cerebral arteries does not come from the ICAs; they come from the vertebral basilar system. Okay, so the vertebral basilar system, the terminal branches are going to be the posterior cerebral arteries, PCAs. Okay, but along the line, guys, as it goes up here and becoming the basilar and give out the PCAs, they are also going to give out branches that nourish the cerebellum and the brainstem as well. Okay, like for example, anterior inferior cerebellar artery, ICA, okay, as well as the posterior and the posterior inferior cerebellar arteries, pica, that should be down here somewhere, are going to be nourishing the medulla oblongata, some of the medulla oblongata, as well as the cerebellum, the underside of the cerebellum. And then after that, you have the pontine arteries, which are also from the basilar artery that nourishes the pons, right? And then you have the superior cerebellar arteries, right? That is going to nourish the midbrain as well as the upper part of the cerebellum. And then finally, you have the posterior cerebral arteries that are going to go outside there and connects with the PCOMs. Okay, so now these arteries that are called cerebral arteries, ACAs, MCAs, and PCAs, those are the arteries that are going to either directly or then give branches to nourish the entire cerebrum. Okay, because anterior cerebral artery, middle cerebral arteries, posterior cerebral arteries, right? So those arteries are going to feed the cerebrum. How? Look, they are going to feed the cerebrum in this way. The ACA branches are going to feed primarily the medial side, okay, the medial side of cerebral hemispheres. Okay, the MCAs are going to feed primarily the lateral sides, okay, the lateral sides of the cerebral hemisphere, while the PCAs, okay, are going to feed primarily the undersurface as well as the posterior part of the cerebral hemisphere. So essentially, anterior circulation, this one and this one, are going to feed both of the medial surface and the lateral surfaces of the anterior cerebrum, while the inferior cerebrum as well as the posterior cerebrum are going to be fed by this posterior circulation coming from the vertebral and basilar circulation, right? So yes, I can make it even better by showing you guys this. The anterior cerebral artery is going to nourish the blue part in the image here. Okay, the middle cerebral is going to nourish mostly the lateral part. You see that of the cerebral hemisphere. So you can see here it's the yellow part right there, and right there. While the posterior as well as the inferior part of the cerebral hemispheres are going to be nourished by the posterior cerebral artery. Okay, so these arterial regions are very important. Okay, as you consider, like for example, if the anterior cerebral artery on the left side is blocked, okay, due to a thrombus, what will happen? Like for example, within a stroke, for example. Okay, very important. Okay, and from the anterior, middle, and posterior cerebral arteries, there are things that are called central arteries that are going to go out. Like for example, from the anterior cerebral arteries, there are these anterior medial central arteries. Okay, from the MCAs, we have these lenticulostriate arteries that are going to go in and basically feed the very deep structures within the two cerebral hemispheres. Like for example, the thalami. Okay, the thalami of the diencephalon is going to be very deep within the cerebrum and it's going to be fed, right? These branches are going to feed it. Okay, thalamotuberal arteries as well. All of these branches that you see here are going to be the ones that goes deep and feed very, very deep inside of the cerebral hemispheres and deeper structures like the diencephalon. Okay, as well as like the basal ganglia. Okay, the putamen, the globus pallidus, as well as the caudate nucleus and other various structures within there. Okay, and then you will have these choroidal arteries. You have the anterior choroidal artery, which is the final artery that comes out of the internal carotid artery. Then you have the posterior choroidal artery from the posterior cerebral arteries. These goes to the choroid plexus to form what? To form the CSF. Okay, these choroidal arteries go to the choroid plexus so that CSF can be formed. Okay, very important. Yes, and so finally, for the veins of the brain, I will not bother you with a lot of the veins of the brain, okay? You just need to know this. All of the veins of the brain will eventually be drained back into these venous sinuses, the dural venous sinuses that we have already talked about before, okay? And the dural venous sinuses are going to look like this. These are the most important tributaries of the dural venous sinuses that I want you to know and identify. Number one is this one here. That one there is the one that we have talked about countless times before, okay? And that one is the superior sagittal sinus, Okay, SSS, superior sagittal sinus. Then you can imagine that the superior sagittal sinus is going to be at the upper part of the false cerebri. Look like that. And then the false cerebri is going to go in like that. You know, the false cerebri is the two meningeal layer of the dura mater that goes inside there, right? And so the false cerebri is going to go down deep inside that, and it's going to enclose another vein here that runs alongside the inferior border of the false cerebri. And that vein right there, you see that vein? That vein right there is called the inferior sagittal sinus. Okay, so you have two sagittal sinuses. You have the superior one and then you have the inferior one. The superior one is this one. Okay, and the inferior one is this one. All right, now let's talk about like, you know, what goes into the inferior one. Now the inferior sagittal sinus is this vein right here. Now veins that are very, very deep within the brain, within the cerebrum, is going to go from these veins right here, these two veins. These two veins are going to be called the internal cerebral vein. And the internal cerebral vein, as well as other veins, like for example, the basal vein of Rosenthal right here, are going to join up into a very, very important vein right there. That vein right there is called the great cerebral vein. Okay, the great cerebral vein. And the great cerebral vein is also known as the vein of Galen. Okay, vein of Galen, because there used to be an anatomist back in the Roman times called Galen, who used to be very, very famous back then. And so because of that, when the vein of Galen was first discovered, okay, they put the name of Galen to honor him. And so that vein right there is called the great cerebral vein of Galen. Okay, and so the great cerebral vein of Galen and the inferior sagittal sinus are going to join together. And the product of their joining is going to be a vein right there that is called the straight sinus. Okay, the straight sinus. Straight sinus. And now look, the straight sinus as well as the superior sagittal sinus is going to join up at a place there. You see that place? That place is the joining up of all the sinuses, all the dural sinuses of the brain. So you will call that point there, okay, the confluence of sinuses. Confluence is where everything joined together. Okay, so you call it confluence of sinuses. Okay, so imagine superior sagittal sinus, inferior sagittal sinus, they're both traveling posteriorly. Inferior sagittal sinus is going to join with, like, you know, the vein of Galen, okay, or the great cerebral vein of Galen, okay, to join the straight sinus. Straight sinus is going to go back, joining the superior sagittal sinus at the confluence of sinuses. Then after that, the veins are going to become these two veins that are run laterally, and you call them the transverse sinuses. Okay, there are two transverse sinuses, one here and one here. Those are two transverse sinuses. And then after that, the transverse sinuses is going to go down and make an S. You see that S right there? And that S right there? Those sinuses that are making an S, they're called the sigmoid sinuses. This one, the sigmoid sinuses. So the transverse sinus is going to lead venous blood to the sigmoid sinus. And then the sigmoid sinus is going to go down. And when it goes down there, it's going to pass through a foramen, here and here. And that foramen is called the jugular foramen. Okay, jugular foramen. And when it passes through the jugular foramen, it is not called the sigmoid sinus anymore, but it's now called the internal jugular vein. So where is the blood from the internal jugular vein comes from? It comes from the brain. Okay, it comes from the brain, your brain. All the sinuses of your brain will get their sinus blood, okay, get all the venous blood all the way to the sigmoid sinus. And sigmoid sinus passing through the jugular foramen to go down and become the internal jugular vein. So the internal jugular vein containing venous blood coming not only from the deeper part of the neck, but also your brain. Okay, very, very important that you need to know that. Now, let's review all of that for a second here. First up, over here, what do we have? Superior sagittal sinus, very good. Now, how about this one? Inferior sagittal sinus, yes, very nice. Then how about these veins here? What do we call these veins? Right? What do you call these veins? Those are the internal cerebral veins. Very good. And then after that, you have the basal vein. Oh, right here is the basal vein of Rosenthal. And then all those veins are going to go together to make what? What is this? This is great cerebral vein of Galen. Yes. And then after that, the inferior sagittal sinus as well as the great cerebral vein is going to come together and make a vein here. What is that? Straight sinus. Yes. And then the superior sagittal sinus and the straight sinus are going to join together at where? Confluence of sinuses. Then the venous blood is going to, from the confluence of sinuses, over to the transverse sinus, then the sigmoid sinus, then the jugular foramen, then the internal jugular vein. Okay, and that, my friends, is how these veins can drain the venous blood from your brain. And that's it. Thank you very much for sticking with me so far. This is the meninges and the vasculature of the brain and spinal cord. Thank you again, and I will look forward to seeing you guys in class next time. Bye-bye. Thank you.